Do you remember the first time you held her hand? The electricity, the certainty, the feeling that your entire world, your whole being, was focused into that single, simple touch. Our lives are a collection of these moments, moments of connection, of passion, of intimacy. They are the threads that weave the tapestry of a life well lived. They define our youth, our manhood, our partnerships. But for so many men, as the years turn into decades, something begins to fade. It's not the love that fades, it's not the desire, it's the signal, the physical echo of that connection. The light that once burned so brightly begins to flicker. The certainty is replaced by doubt. The spontaneity is replaced by anxiety. The bedroom, once a place of passion, becomes a room of quiet frustration and unspoken disappointment. If that feeling is familiar to you, I want you to listen to me very closely. You are not alone, and more importantly, you are not powerless. My name is Dr. Beatrice Shaw. For over 15 years, I've been a doctor of medical science and a practicing urologist. I've sat with thousands of men in your exact position. Good men. Men who have built families, careers, and legacies. Men who feel like a fundamental part of their identity is slipping through their fingers. They come to me after trying everything. The little blue pill, the injections, the vacuum pumps. A clinical, cold approach to something that is so deeply warm and human. They're tired of the side effects, the cost, and the feeling of being a patient with a problem to be managed. They ask me, "Doctor, isn't there another way? A more natural way to get that spark back?" For years, the conventional answer was a hesitant no. But what if I told you that some of the most profound solutions aren't found in a futuristic lab, but in the wisdom of the past? What if I told you there is a simple, nightly ritual, a ritual that costs pennies, that has been used for centuries, and that targets the very root causes of this decline in a way that modern medicine often overlooks? Today we are going to talk about this, castor oil. But more importantly, we are going to talk about a very specific, often neglected spot on your body. A kind of master control center for erectile function. When you combine the unique properties of this oil with the right location, you are not just treating a symptom. You are starting a process of deep, foundational healing that can improve blood flow, regenerate nerve sensitivity, and relax the very muscles that control your erections. This isn't a magic pill. This is a practice, a commitment to your own vitality. So get comfortable, turn off the distractions, because the information in this video has the potential to rewrite the next chapter of your intimate life. Let's begin. All right, before we can rebuild something, we first need to understand why it broke. When it comes to erectile health, especially as we pass the age of 50 and 60, it's almost never just one thing. It's a combination of factors, a perfect storm that slowly erodes function. Let's break down the three primary culprits. First, and most importantly, is blood flow. Think of a healthy erection like a powerful rushing river filling a reservoir. In your youth, the riverbanks are wide, smooth, and clear. Water flows in effortlessly and powerfully. These riverbanks are your arteries. But over decades, sediment starts to build up. This is plaque, inflammation, and a loss of elasticity in the arterial walls, a condition we call atherosclerosis. The river becomes narrow, clogged. The flow of blood becomes a trickle instead of a torrent. The arteries feeding the penis are incredibly small. They are often the first place in the body to show signs of this blockage. This is why erectile dysfunction is often called the canary in the coal mine for heart disease. It's an early warning sign that your entire circulatory system is under stress. So, the first problem is plumbing. Not enough blood is getting to where it needs to go. The second culprit is nerve function. If blood flow is the plumbing, then your nerves are the electrical wiring. An erection doesn't just happen. It begins with a signal from your brain, which travels down your spinal cord and through a complex network of nerves in your pelvis. These nerves tell the arteries to open up, the muscles to relax, and the chambers of the penis to fill with blood. As we age, And especially for men with conditions like diabetes or who have had pelvic surgery or injuries, this wiring can become frayed. Nerve signals can become weaker, slower, or less coordinated. You might feel the desire, your brain might be sending the signal, but the message gets lost in transmission. The result? A weak response or no response at all. This also leads to a loss of sensitivity, which is a key component of an enjoyable and sustainable erection. And the third, often completely ignored culprit, is tissue health and the pelvic floor. This one is critical. Think of the tissues of the pelvic region like a patch of fabric. When you're young, that fabric is soft, supple, and elastic. It stretches and moves as needed. But over time, due to chronic inflammation, lack of blood flow, and muscular tension, that fabric can become stiff and riddled with tiny amounts of scar tissue. This is a process called fibrosis. Simultaneously, the muscles of your pelvic floor, the very muscles that support your organs and play a crucial role in trapping blood in the penis to maintain an erection, can become either too weak or, more commonly, too tight. Chronically tight, or hypertonic, pelvic floor muscles are like a constant clamp on the plumbing and wiring. They physically constrict the blood vessels and irritate the nerves we just talked about. So we have a plumbing problem, blood flow, an electrical problem, nerve signals, and a structural problem, stiff tissues and tight muscles. The pills? They mainly address the plumbing and only temporarily. They are a powerful tool, but they do nothing for the underlying nerve health or tissue quality. This is where our ancient approach comes in. We're not just trying to force the river to flow, we're trying to rehabilitate the entire ecosystem. Castor oil. It's been called Palma Christi, or the Palm of Christ, for its perceived healing abilities. It was used by the ancient Egyptians for everything from medicine to fuel for their lamps. It is mentioned in medical texts from ancient Greece, Rome, India, and China. But for our purposes, we're not interested in folklore. We're interested in pharmacology. What is in this thick, viscous oil that could possibly help with a problem as complex as erectile dysfunction? The answer lies almost entirely with one unique fatty acid. It makes up about 90% of castor oil. It's called ricinoleic acid. Ricinoleic acid is special. When it is absorbed through the skin, it has several profound biological effects that directly counteract the three culprits we just discussed. First, it's a potent anti-inflammatory. Ricinoleic acid interacts with specific receptors in your tissues called prostaglandin receptors. Think of these as little docking stations on your cells. When activated in a certain way, they can significantly calm down inflammation. Why does this matter? Chronic inflammation is a key driver of arterial plaque and stiffness. By reducing that inflammation directly in the pelvic tissues, you are helping to create a healthier environment for your blood vessels. You're clearing the sediment from the riverbanks. Second, it appears to stimulate circulation and lymphatic drainage. The lymphatic system is your body's waste disposal network. When it's congested, inflammatory byproducts and cellular waste hang around, making everything sluggish. When castor oil is applied with gentle massage, it is believed to help get this system moving again. Better drainage means less inflammation and better delivery of oxygen and nutrients via the blood. So, it not only helps the blood get in, but it also helps the waste get out. Third, and perhaps most intriguingly, it can soften tissue and break down adhesions or fibrosis. This is the property that has made castor oil packs famous for helping with internal scarring and cysts. Remember that stiff, weathered fabric? Ricinoleic acid acts as a powerful emollient and penetrates deeper than many other oils. The theory, supported by a vast body of anecdotal evidence and clinical observations from holistic practitioners, is that consistent application can gradually help to soften and increase the pliability of hardened connective tissues. This can free up constricted nerves and blood vessels, restoring that youthful elasticity to the entire region. So, by applying castor oil topically, we are aiming to 1. Reduce inflammation, a root cause of arterial blockage. 2. Improve local circulation, bringing more healing and oxygen to the area. 3. Soften hardened tissue, freeing up the nerves and blood vessels that are being choked off. Now, I must be very clear here as a medical professional. Large-scale, double-blind, placebo-controlled studies on applying castor oil to the perineum for erectile dysfunction have not been published in major urological journals. This is not a treatment that has been FDA approved. However, the biochemical mechanisms of ricinoleic acid are well understood. The principles are sound, and the volume of positive reports from men who have committed to this practice is too significant to ignore. We are operating in the realm of supportive, holistic care that complements, rather than replaces, conventional medical advice. Now let's get to the most important piece of the puzzle. Where exactly do you apply it for maximum effect? For any medicine to work, it has to be delivered to the right place. You wouldn't put eye drops in your ear. In our case, the target isn't the penis itself. Applying the oil there will moisturize the skin, which is beneficial, but it's like watering the leaves of a plant when the roots are dry. We need to go to the source. The spot we are targeting is called the perineum. Anatomically, the perineum is the bridge of land between the base of your scrotum and your anus. It's a small area, maybe an inch or two long, but it is arguably the most important piece of real estate in the entire male pelvic region for sexual function. Let's look at why. Right beneath the skin and muscle of your perineum runs a superhighway of critical structures. First, you have the pudendal nerve. This is the main nerve for pelvic sensation and function. It carries the signals for arousal and orgasm. It controls the muscles that help you get and maintain an erection. If this nerve is compressed, irritated, or inflamed, your sexual function will suffer dramatically. Next, you have the major blood vessels. The internal pudendal artery passes through this region before branching off into the arteries that actually feed the penis, the dorsal artery and the cavernous arteries. By targeting the perineum, you are treating the trunk of the tree, not just the branches. Improving blood flow here means improving blood flow to the entire erectogenic system. Finally, this is the center of your pelvic floor muscles. Specifically, muscles like the bulbospongiosus and ischiocavernosus, which are directly involved in the mechanics of an erection. They contract to help pump blood into the penis and to clamp down at the base to prevent that blood from leaving too quickly. When these muscles are chronically tight from years of stress, sitting, or improper posture, they literally strangle the nerves and arteries running through them. So, the perineum is the grand central station of your erections. It's where the wiring, the plumbing, and the structural supports all converge. By applying castor oil with gentle massage to this specific spot, you are delivering its anti-inflammatory, circulatory enhancing, and tissue softening properties directly to the command center. You are calming the irritated nerve, nourishing the choked-off artery, and relaxing the clenched muscle. This is a level of targeted grassroots healing that a pill simply cannot replicate. All right, this is the most practical and important part of the video. I'm going to walk you through the exact ritual, step by step. Remember, consistency is more important than intensity. This should be a relaxing, mindful practice, not a chore. Step 1, get the right oil. This is non-negotiable. You must use a high-quality castor oil. Look for 3 things on the label. 1, cold-pressed. This means it was extracted without heat, which preserves the delicate fatty acids and nutrients. 2, hexane-free. Hexane is a chemical solvent used in cheaper extraction methods. You do not want to be rubbing a chemical solvent on the most sensitive skin on your body. 3, organic. Recommended. This ensures it's free from pesticides. It will usually come in a dark glass bottle to protect it from light degradation. Step 2, the patch test. Before you begin, you must do a patch test. Castor oil is generally very safe, but a small number of people can have a skin reaction. Pour a single drop on the inside of your forearm, Cover it with a bandage and leave it for 24 hours. If there is no redness, itching, or irritation, you're good to go. Do not skip this step. Step 3. Preparation and setting. The best time to do this is at night, right before bed. This allows the oil to work undisturbed for several hours. It also helps your body and mind shift into a relaxed, parasympathetic state, which is essential for healing. I recommend taking a warm bath or shower beforehand. This cleans the area and, more importantly, the warmth helps to open up your pores and increase circulation, which will improve the oil's absorption. After your shower, go to your bedroom, dim the lights. Maybe put on some calming music. This is your time. Step 4. The application. You'll need the oil, an old towel to sit on, castor oil can stain fabrics, and a pair of old, comfortable briefs or boxer briefs you don't mind getting oily. Pour about a tablespoon of castor oil into the palm of your hand. Don't use it cold from the bottle. Rub your hands together vigorously for 20-30 seconds. This friction will warm the oil, making it much more pleasant and absorbable. Now get into a comfortable position. The easiest way is to lie on your back with your knees bent and feet flat on the bed, allowing your legs to fall open slightly. This gives you easy access to the perineum. Step 5. The massage. Using your fingertips, apply the warmed oil directly onto the perineum, that area between the scrotum and anus. Now, begin to massage, but I want you to be very specific about the technique. We're not just rubbing it in. Use gentle, steady pressure. Imagine you are trying to massage a ripe peach without bruising it. Use slow, circular motions. Go clockwise for 10 circles, then counterclockwise for 10 circles. Feel the tissue underneath. Your goal is to gently mobilize the skin and the superficial tissue over the deeper muscle. You may feel some tenderness or tightness. That's a sign you're in the right place. Do not press hard or try to work out the knots. The oil and gentle motion will do that over time. Extend the massage. While the perineum is the primary target, don't be afraid to gently massage the oil around the base of the penis and scrotum and up onto the lower abdomen, just above the pubic bone. This entire area is part of the same interconnected system. Do this for 5 to 10 minutes. This is not about speed. It's about mindful touch and connection with your own body. Use this time to breathe deeply, letting go of the day's stress. Step 6. Let it absorb. Once you're done with the massage, don't wipe the oil off. Put on your old pair of underwear to protect your sheets. Go to sleep. Let the ricinoleic acid work its slow magic overnight. You do this every single night, or at least 5 nights a week. Consistency is the secret. You are slowly, night after night, unwinding decades of tension, inflammation, and stiffness. What can you expect? Don't expect a miracle on day 1. For some men, they notice a change in sensitivity or morning erections within a week or 2. For others, it might take a month or 2 of consistent application to notice a real difference in erectile strength and sustainability. Be patient. You are healing your body on a foundational level, and that takes time. The ritual we just covered is incredibly powerful on its own. But if you want to accelerate your results and truly reclaim your vitality, you cannot ignore the rest of your lifestyle. The castor oil massage is one pillar of a temple you are rebuilding. The other pillars are just as important. While some communities suggest mixing other ingredients with castor oil, I strongly advise starting with pure castor oil alone. Master the foundational practice first. Now, let's talk about the big 3: diet, movement, and mind. Pillar 1. Eat for blood flow. You need to eat foods that help your body produce nitric oxide. Nitric oxide is a gas molecule that is the primary signal for your arteries to relax and open up. It's nature's own vasodilator. Foods like leafy greens, beets, garlic, dark chocolate, nuts, and watermelon are packed with nitrates and antioxidants that directly support this process. Think of it as providing your body with the raw materials to fix the plumbing from the inside out. At the same time, you must reduce the foods that cause inflammation and clog your arteries. Processed sugar, industrial seed oils, and excessive fried foods. Pillar 2. Move for your pelvis. General cardiovascular exercise, brisk walking, swimming, cycling, is fantastic for your overall heart health and blood flow. Aim for at least 30 minutes most days of the week. But I also want you to incorporate 2 specific types of movement. First, pelvic floor stretches. Because many of us have tight pelvic floor muscles, we need to learn to release them. Simple stretches like the happy baby yoga pose or deep child's pose before bed can help release that chronic clenching. Second, Kegel exercises. Once you've learned to relax the muscles, you can then learn to strengthen them. Kegels involve consciously squeezing and lifting the same muscles you use to stop the flow of urine. This improves your muscular control, which can help you maintain erections longer. Pillar 3. Master your mind. This might be the most important pillar of all. Anxiety is the enemy of arousal. If you've experienced erectile issues in the past, you can get caught in a vicious cycle of performance anxiety. You worry it will happen again. That worry releases stress hormones like cortisol, and cortisol is a potent erection killer. The nightly castor oil ritual is a powerful tool against this. It's a form of meditation. It quiets your mind and reconnects you to your body in a positive, non-sexual, healing way. I also encourage a simple mindfulness practice. Just 5 minutes a day, sit quietly and focus on your breath. This trains your brain to break free from anxious thought loops. It gives you back the control. The journey back to vitality is not about chasing a phantom of your youth. It's not about being the man you were at 25. It's about becoming the best version of the man you are right now. It's about honoring the body you have, understanding its needs, and giving it the gentle, consistent care it deserves. It's about trading anxiety for mindfulness, frustration for patience, and disconnection for a new kind of self-care. This practice is more than just a technique for stronger erections. It is a statement that you are not content to let the light flicker and die, a statement that you are willing to tend to the flame, to nourish it, and to help it burn brightly once more. The connection you share with your partner and the connection you have with your own body is precious. It's worth fighting for. Not with harsh chemicals or invasive procedures, but with wisdom, patience, and the profound healing power of nature. Commit to this practice. Embrace the holistic lifestyle that supports it. Be patient with yourself and celebrate the small victories along the way. You have the power to change your story. Thank you for spending this time with me. If you found this video helpful, please give it a like so that more men who need to hear this message can find it. Subscribe to the channel for more deep dives into men's health and vitality. And I would love to hear from you in the comments below. This is a community. Share your journey, ask your questions, and support one another. What is one change you are going to commit to starting today?